Jamba, and I know a lot of you are already familiar with him. You may have watched him as he grew from his birth into a very beautiful puppy. Jamba asked me to devote this video to a discussion of Cavalier health, specifically heart health. You may know that with any purebred dog, there are certain diseases that are common to that breed. One of the diseases, and there are several with Cavaliers, but one of the diseases with Cavaliers that's common to the breed is heart disease, and specifically mitral valve disease, where the mitral valve of the heart leaks and regurgitates blood back into the heart, and therefore doesn't allow the heart to pump blood through the body as it should. There are a few things you should know. First of all, if you are looking for a puppy, make sure that you find a breeder who tests both the mother and the father of the puppy for signs of heart disease. Heart disease can only be detected from symptoms. There's no blood test, there's no DNA test, and so the only way to determine if a dog has heart disease is to see if symptoms show up in the form generally of a heart murmur. And so if you find a breeder who waits until his or her dogs are at least 2 years old and then has them health tested by a cardiologist to see if there's any presence of a heart murmur and is willing to show you certification that those tests were done and that both dogs passed, you will have a much lesser chance of getting a puppy that eventually develops heart disease too early in life. Secondly, if you do get a puppy, make sure you give that puppy the proper care to minimize the chance of any other factors contributing to heart disease. You want to make sure your puppy's not overweight. When I feel Jamba's side here and run my hand along the side, I can feel his ribs through a light layer of fat. And if I look at him from the top, I will see down here a narrowing at the waist. If you don't feel the ribs and you don't see a narrowing at the waist, then your dog is overweight. And that overweight puts additional stress on the heart and is a contributing factor to heart disease. Also, make sure you take care of dental health. We've talked about that in other videos. And any infection that develops in a tooth or in the gums can spread bacteria through the bloodstream, and that bacteria can contribute to heart problems, so you don't want that to happen either. Make sure your dog gets plenty of exercise, is on a good diet, preferably a diet with a dog food that contains taurine, which is an ingredient that helps to maintain heart health. Third, when your dog is old enough, virtually any Cavalier, if it lives long enough, is going to develop a heart murmur. As long as it doesn't develop early in life, it's not a factor that's going to shorten the dog's life. But when the dog is old enough, then make sure you make regular visits either to your vet or even better, to a cardiologist. And by the way, you can visit cardiologists at clinics that are run by dog clubs all over the country, and you can see a cardiologist and have them check your dog's heart for a lot less cost than it is to visit them in the office. As the dog ages, you'll want to know how severe the murmur is. Heart murmurs are graded from 0 through 6, 0 meaning no heart murmur, 6 meaning the most severe. My own opinion is that once the murmur gets up to about a grade 4, that's the time that you want to intervene with medication. The medication of choice these days is Vetmedin. Vetmedin is known to not only control but also sometimes to reverse the symptoms of heart disease. And so putting the dog on that medication when the murmur is severe enough to warrant it is going to help prolong the dog's life. Eventually that heart murmur will probably cause the dog to go into congestive heart failure, which sounds horrible, but it's not really an immediate death sentence for the dog. There are other medications that help to minimize those effects. The ones that are usually used are Lasix and enalapril, and those two drugs, which also, by the way, are very commonly used by humans with heart problems, will help to minimize the buildup of fluids, help the heart work more efficiently. If you take all those steps, find the right breeder, be careful as you raise your puppy that all the environmental factors are in place to maintain heart health, and treat with medication when the diagnosis shows that it should be done, I see no reason why your Cavalier can't live to an age of 13, 14, even 15 years old, sometimes older. So Jamba looks like he wants to take a nap soon anyway, so I think it's time we say goodbye. Bye for now.